Hello, I'm Ash Dhamma, the CEO of MEDgle, and this here is an overview screencast of MEDgle's Clinical GPS Software as a Service application. This application can be used by pharmacists, nurses, and physicians in the clinical setting, as well as in private practice. So let's go ahead and jump on in. So there are four major sections, the first being Clinical GPS, which allows people to understand what potential diagnoses are relevant, potential next steps, and information that they can go ahead and make a decision with. Second is our lookup section for getting quick information about diagnoses, procedures, or medications. Third is the search and analytics section, which allows us to search and dice all the interviews that have been done, and especially useful in the enterprise setting. And lastly is the My Account section, which allows you to go ahead and manage your account. So let's go ahead and jump into Clinical GPS. So initially, there are four major sections: the patient information, symptoms and signs, suggested questions, and current results. Now, the patient information is entirely optional and to be used to integrate with EHRs, practice management, or pharmacy management applications. Second are the symptoms and signs section, which allows us to be able to capture the information that is provided by a patient, as well as additional information such as vitals and others. Second is our suggested questions section, which after through the analysis of the given information comes up with questions that should be asked or potentially reviewed. And then here we have our current results, which shows you what diagnoses are relevant and some additional information to help you make decisions. So let's go ahead and jump in. So let's go ahead and say that you are in a pharmacy, you're a pharmacist, and a patient walks in. And they're right now complaining of some blisters, on their feet, you know, and this has been going on for 3 days. They're a male and 23 years old. And what this allows us to do is when we click calculate, it will go through and analyze the information that's been given and come up with suggested questions, current results, and possible stat procedures. So under suggested questions, it comes up with emergent symptom questions that will allow us to help in or rule in or rule out emergency conditions, as well as lifestyle modifiers that are relevant. Do you have diabetes, STDs, injury, etc.? Here we come up with our current results, which shows us what potential diagnoses are relevant. Here we have a histogram which represents how our diseases are laid out with respect to emergencies. Level 1 being life-threatening, level 2 being emergent, 3 being urgent, and 4 being same day. And then we have our average score, which looks at the probabilities, the likelihoods, the additional information, as well as the potential emergency levels, and comes out with an average level of 4. In this case, same day. And same thing for the high level. So we really don't have any major emergencies. Now, on this column over here, we have the possible stat procedures. These are the procedures which allow us to either rule in or rule out our life-threatening, rule in or rule out our emergent urgent conditions, and for the rest of potential diagnoses. Now, on top of all this, let's say we have some additional information about this particular patient. Let's say we happen to know that the person is a diabetic. Please note here that this already comes up in the lifestyle modifiers as an important question to ask. So let's go ahead and say yes, that person is a diabetic, and we happen to know that because it's already inside the practice management or pharmacy management application. What we can see here is by taking that into account, it actually shifts our results, and what we have here now is diabetes showing up as the top result, and then we can click on diabetes for more information about that. And so we have information about that, common symptoms, other related diagnoses, diagnostic tests, and then therapeutic sections, in which there's also a sponsor section where we can see if there's any particular things that a company would want to sponsor when using this application. Now, the interesting thing here is we can go back and let's say, does this potentially change if this was like, say, a 50-year-old? And right now here, we see that there's not many major conditions, and even for a 50-year-old, it really doesn't shift that much. And so for this particular case, we are really not dealing with a life-threatening situation. But what one can clearly see here is this provides a very strong foundation to have a discussion with the patient. So the pharmacist, when talking with the patient, can go through and describe what is going on, give them details, and really provide a means and a channel for them to have a very engaged relationship with that patient. Same thing for nurses and physicians. It really gives them a tool by which they can engage that patient. Now, this here has been a very short overview of MEDgle's Clinical GPS. Please do come by and visit MEDgle at www.medgle.com for more information on MEDgle. It's a variety of products, as well as further details on Clinical GPS. We look forward to hearing from you and hope things are going well. Cheers.